In my previous video, I mentioned that in case of disc disease, only 2% of patients will need surgery and the remaining 98% can be managed without surgery. Although this might offer a sigh of relief for a victim momentarily, the next question that will pop up in his mind is, am I going to be in the 2% group or 98% group? This video is to clarify that. First and foremost, the MRI must reveal a convincing compression of the spinal cord to start with. In this backdrop, a patient's clinical presentation should match as well. There are three situations where emergency spinal surgery is mandatory and urgent. Number one, any problem with control of urine or stool. In this situation, the surgery must be performed within hours. Number two, presence of paralysis in one or two muscles or the whole leg. Here, the surgery is needed within days. Number three, intolerable sciatic pain, which means pain in one or both legs, not responding to any type of painkiller for more than 3 weeks. Now, making a decision is very tough. You tend to discuss with family, friends, and within yourself because only you know what it needs, what are your resources, what are the commitments that are pending, and so on. In a spinal problem, remember one thing: doing surgery when not indicated may result in a disaster. Similarly, not doing surgery when indicated will also result in disaster. Usually, friends and family will mostly discourage you from going for surgery, which is out of their concern and there is nothing wrong in it. But the majority do not realize that they are not medical experts, but still they talk more than a surgeon, all from Google. While they offer free advice, they offer nothing to resolve your suffering. If any disaster happens without undergoing surgery, they are not accountable. They simply disappear. You should have the wisdom to acknowledge their support, but should not succumb to their perpetual pressure. Once you are convinced that surgery is indicated and needed, next, just focus on choosing the right doctor, the right hospital, and the right procedure which you may discuss with the surgeon and choose. Then go ahead without any further delay. Unnecessary delay when emergency spinal surgery is indicated might cost you a fortune and make you regret for life, but unfortunately without any hope.